It started at a very difficult time in Sacramento County. In 2010, we were just out of the recession. Well, not quite out of the recession, really, but we had had very severe cuts in the mental health system. So the community was very invested in finding creative strategies to be able to improve the crisis continuum of care.
Many folks, given the retrenchment that had taken place, found themselves needing to go to hospital emergency departments to actually get treatment. It's costly, it's not very effective. It's also not a good way to treat people, period.
We had a work group that really was trying to look at what can we do better, what can we do differently, what can we innovate in our community around the crisis continuum of care. We felt we had a gap around a pre-crisis or early intervention that people could have.
The Mental Health Services Act, they have several components, and one is called the Innovation Program. And it allows counties to test out all different kinds of activities and services to really learn brand new lessons. It lets them be creative. Sacramento County developed this interesting project called the Respite Partnership Collaborative Innovation Project. And we came to evaluate and to understand what kinds of lessons the county was going to learn by offering these respite services in the community, engaging in public-private partnership, and engaging in a community-driven process.
RPC actually represented an opportunity not simply to rebuild something that we were not satisfied with, to do something that was really different, to bring the delivery of mental health services closer to communities, to do it in a way that was culturally sensitive and responsive.
As a public-private partnership, that the county is able to bring their expertise around mental health service delivery, and that Sierra Health Foundation Center for Health Program Management has been able to bring their expertise around grant making and community engagement.
The public and private partners, or Sierra Health Foundation and the county government, were able to create, launch, maintain, and complete this pretty elaborate Respite Partnership Collaborative project over several years. They were also able to maintain a shared vision for improving the mental health services in Sacramento County. And they were able to learn about the unique contributions that each entity brings to the table. So Sierra Health Foundation really brings the gift of engaging the community and partnered with the county government and their expertise in mental health delivery systems. This was really a very strong partnership for supporting the RPC overall.
This was an opportunity to do all that it was created to do. It was innovative, it's about partnership, it's about change, and most importantly, it's about elevating the voice of community.
And the role of the collaborative has been to be a voice around mental health respite in Sacramento County. So their role has been to help prioritize what mental health respite will look like in Sacramento County, but also to prioritize how that funding will go out into the community through community grants.
The 11 projects that were delivered as part of this program were very successful in terms of reaching unserved, underserved populations and people in crisis to getting access to something that was not there before.
I think it's very rare to see county government, private foundations, community members come together for several years in order to work together to offer funding to community-based organizations and to promote these kinds of new services that really seem to have made a difference among the clients that we talk to.
I would say that one of the really nice things about this project is that it has been able to give an opportunity for longtime providers who have been part of our system to test out some new approaches. And it's also given an opportunity for new providers and new types of interventions in our community.
I was involved as a community stakeholder. The work continues. There is still a significant need in many communities for respite to continue, for respite programs to be developed, and so that's a process that we'll always have to continue to look at and ensure that communities that are in crisis, individuals that are in crisis, have the supports and services that they need.
I think that in the future it'll be easier, not easy, but easier to have the kind of tough conversations that we need to have as we continue our rebuilding of the mental health delivery system. RPC has done some extraordinary things and deserves to be celebrated, but there's still a lot more work to do.